Hey everybody, American Thought Project here. Nick Olavencia with my buddy Robert Barbosa. Robert, what are we doing here, man?
So Nick and I have had this passion for individual liberty, Americanism, what it really means, what our founding ideals are. We've just been tossing back and forth ideas on how we can provide a platform to further that agenda, have intelligent debate with folks that we both agree with and don't agree with, and ultimately just provide like a baseline foundational level of education and understanding for these values that we hold dear, and what our country was founded on. And again, just kind of dive in and just have conversations, real conversations with people, and discuss these things and kind of look at current events through that lens.
Yeah. I think we just really want to have like a political dialogue. I don't know what happened or when this became so difficult as a country, but it seems like there's so much animosity in the political spectrum today. We just want to have a dialogue. We just want to have a discussion because a population that does not have discussions about politics is doomed to tribalism and violence, and we're seeing it all over the country today. So I
Right.
think we just want to have a good chat. I'd love to have some guests on the show, people that agree with us, people that don't. I think it'd be really good to have, again, just to host kind of a dialogue. So
Right.
anyway, for today, I think, obviously it's, May, almost June, but May 2020. So the topic of consideration is COVID-19, right? So I
Yeah.
think that's kind of we would want to talk about like the government response and kind of what's been going on there. But what are your thoughts right now?
Yeah, I think I love this discussion because we have a real problem, well,
Yep.
on our hands, and we're not just having a theoretical debate. It's like, hey, there's something in our front door that we need to discuss, and it has real implications on our individual liberty and freedom, and we see that playing out. So I think with the COVID-19 discussion, there's really two main pillars, and then subsets off of that. One is the government response. What are the implications on our individual liberties? And what is our Constitution actively protecting and securing our rights from? And then the second piece is what's the efficacy behind the decisions that were made, right?
Yeah.
So I think, in my opinion, let's first start with the constant, which is our individual liberties as free American citizens. And because that holds true regardless of what happens, regardless of the threat to our well-being, regardless of whatever the event is. The second piece, the efficacy piece, may change depending on what the threat is, right?
Right. Yeah. And so, obviously we don't want to be an armchair quarterback, but, I think it's our responsibility as citizens to critique the government responses to
Yeah.
anything that happens, regardless of who it is or what's going on. So, why don't we kind of rewind the clock here to February, we'll say February of this year. What do you think about the Trump administration's original plans to shut down the country, travel bans, all that stuff, when we first saw this coronavirus threat becoming a real problem?
I mean, hindsight's 2020. I can emphatically say now, I think the majority of it was wrong, and not optimum. Um, Especially because decisions were made off of theory. But a portion of it doesn't really matter because to what extent should liberties be curbed in crisis? My answer is none. It doesn't, like war, crises, or otherwise anything that might actually be a threat to our well-being is not a justification for stripping us of our individual life, liberty, and the actions needed to sustain that life, right? So I think we're also an amenable society and we're willing to sacrifice things for a noble goal. But the primary precursor to me is it needs to be voluntary. The federal government does not have the right to stop the ability for an individual to provide for themselves. So I think from that perspective, wrong. Do I think some measures were needed to be taken because we were acting on poor data? Yes, but I don't know how we can rationally get to a point where we justify stripping people's individual liberties.
Well, I mean, let's first of all let's figure out like whose problem it is. 10th Amendment says everything not discussed here in this Bill of Rights and this Constitution is left up to the state. So it's actually like the state's responsibility. And in my opinion, the Trump administration did the right thing by setting out guidance. Right, this is what we think you all should do.
Right.
But ultimately, the orders, anything that is restricting anybody's freedom or any actual measures taken, is predominantly dealt with at the state level. So
Yeah.
those were the governors that were taking that and taking the initiative there, and that's where the actual laws are coming from. But I mean, I think that the delegation was absolutely appropriate and that this was the state's issue.
Yeah. Yeah, I guess I agree with you on the point that hey, it was
Like health and
encouraged
public
by
safety
the
is up to the
federal
states.
government. Yeah. And you could argue that this has to do with national security as well. So from that
That's
perspective,
true.
I commend the administration for not overstepping in those regards. Um, but I guess my bone to pick would be with the state legislatures and governors then, because we still had like coming out of the administration guidelines of non-essential workers. I've never had a non-essential job in my life, you know, so that's arbitrary. You know, it's really arbitrary. So, um, yeah, I guess I could concede that, hey, to have guidelines and suggestions for the states and to see federalism, you know, acted out in a proper manner, that's great. But to have governors straight up say there's stay-at-home orders, a stay-at-home order has less value than a piece of toilet paper because it's utterly unconstitutional. You cannot tell an American citizen that they have to stay in their home, that they can't go to work. You can't strip a business owner of their property and say when you're shutting down a business, you are stripping people of their property and you're stripping people of their labor. And just compensation clause says you have to adequately compensate people if you're going to do that for it to be constitutional. That did not happen. I would argue, based on principle, I don't think the government should ever have the ability to seize private property or labor. It's a discussion for another time. But even to meet the constitutional standards for this to happen, those were not met.
Yeah, well, I think the standard that is definitely not met, and that will probably be seen challenged in various levels of court, is the fact that the orders were not narrowly tailored, and that is a really big issue, and that's what typically the Supreme Court looks at when they're striking down issues that are not. Is there a compelling government interest? Absolutely yes, health and public safety. But was it properly narrowly tailored? So I think where the real big blunder was okay, so it's good you've got the federal government delegating down to the states, but I think the governors failed miserably on both sides of the aisle. They were passing, wide sweeping statewide orders. I'm in Texas. It's a pretty big place.
Yeah.
You're in California. It's a pretty big state. And they're passing statewide orders that are restricting, effectively your ability to provide life, liberty, pursuit of happiness.
Yeah.
Across the board, when I think they should have delegated to lower levels, like municipality level or the county or what have you, or at least, even dividing Texas up into 5 groups
Yeah.
would have been better than having a stay at home across the board. So I feel like, General Mattis, right? He was Trump's first Secretary of Defense. One of his principles is always delegate to the lowest capable level, because
Right.
they have the best information on the ground to make the best decisions. And that is clearly where I think the governors across the board just kind of dropped the ball there.
Yeah. Yeah, for sure. But I'd go back to, it doesn't matter what level some sort of unconstitutional edict is put forward, it's still unconstitutional. So
Okay.
I
Yeah.
think there is a lot of argument and posturing on both sides of the argument just based on emotion and not like, well, what? I like that this is kind of prodding people to think, wait, did I have liberty that was secured by my government that has their just power because of my consent? Did I actually have that, or did I have privileges? If the government can
Ooh,
switch them
yeah,
on and switch them off whenever they want, or whenever even the majority wants, right? I mean, this idea of a constitutional republic is to protect the ultimate minority, which is the individual. And majorities still rule to a certain extent, but never at the expense of the minority's rights, inalienable rights.
right.
So to me, it's like, hey, dude, if the governor or if the mayor can say, stay at home, your place of work is shut down, you can't make that decision. I'm going to make it for you. That's unconstitutional.
Yeah, I mean,
That's a privilege.
it's certainly, yeah, it certainly seems like an overreach of government power. And when you think about, the idea of paternalism, right? Paternalism is the idea that somebody who's more informed than you, or more intelligent, or more educated, or whatever you want to put on it, should make decisions for you because they know better than you do.
Right.
And we as a society, as a constitutional republic, grapple with this problem all the time. We already have a degree of paternalism where we elect representatives that go to Washington and act on our behalf. But remember, there is nothing to stop them from doing what we don't want them to do. The only way we check that is by voting them out in the next election. But
Yeah.
your congressman or your senator is not asking for your permission to vote a certain way on a certain issue.
Right.
So we already give up a little bit of our freedom in this form of a republic, as opposed to like a pure democracy where you were to vote on everything. But I think it's pretty easy to see that it's gone way too far. And
Yeah.
now we are at a point where you have people in ivory towers that are making wide sweeping orders and telling everybody what to do. And our founding fathers are rolling in their graves right now
Yeah.
because that is literally what they were trying to avoid
Right.
throughout the entire making of the country.
Yeah. And I think, I've been bashing, the government's response to a lot of this. And so the question comes back when I say, hey, to what, or people say, to what extent should your liberties be curbed? Do you agree with what the government's doing? These questions, I say, first of all, liberty shouldn't be curbed. Second of all, I don't agree with what's going on. So then what is the role of government? Well, the role of government, the government does have a role in this, right? To me, it's to provide information and resources that are used with the decisions made from said information. And I have a lot more confidence in the American individual making decisions for themselves based off of their own risk analysis than I do the government officials making arbitrary decisions like what's essential and what's not. A liquor store's open, but a small mom and pop restaurant isn't. Costco's open, church isn't. Home Depot's open, and I can't go to the local, Rubio's with 6 people and 2 cooks. Like this is arbitrary. So when you make decisions in what Thomas Sowell would call first order thinking, and you don't think of secondary and tertiary effects, you create a worse problem. So I just think we likely need to answer the question, so what's your view of government's role in this, right?
Yeah,
And
yeah.
to me, it's what I said, because government's only just role is to secure and further our individual liberties. When they become, quote, destructive of these ends, it is not only our right, it's our duty to abolish that and throw it off. And you've seen that with Elon Musk, probably the highest,
Oh, yeah.
the most notoriety. There's a reason why everyone who challenges these unconstitutional edicts wins, in the long term. And the salon owner in Dallas was, momentarily arrested, or whatever, and she's going to win a massive civil lawsuit because of that. There's a reason why they win, because
they're not founded in just law.
Court. It can't hold up in court. It is utterly unconstitutional.
Yeah, and I think it goes a little bit even deeper. It's like if we do not trust the individual to assess the risks for themselves, to have good access to government guidance, don't get me wrong, but make their own decision about how to live their lives, then what is the point of all this?
Yeah.
What is the point of this country? It literally is, this is the whole point of the experiment of this constitutional republic, is that the individual has the right to make decisions for themselves, and who are we to we don't want people overarching them and making decisions for them. But I mean, Martin Luther King right here. One has not only a legal but a moral responsibility to obey just laws. Conversely, one has a moral responsibility to disobey unjust laws.
Right.
I mean, he literally hit the nail on the head right there. And like you said, that's why whenever you're seeing stand downs, whether it's the salon opening, right? And I think that was in Texas, right? It was a salon that was opened against the order, arrested, and then released. And then the governor of Texas came out and said, absolutely no more detainments for violating stay-at-home orders. We're seeing the challenges come through, by the way, healthy civil disobedience, peaceful nonetheless. And we're seeing that fall, those because those executive orders are not built on solid legal ground.
Right, for sure. And I think, something that is important to point out is, while our individual liberties as expressed in the Declaration of Independence and codified in the Constitution, and those are constant, they're inalienable, and they cannot be taken away from us because we already have them. They were endowed to us by our Creator. The government's just there to secure them, right? That's a truth. And then the other side of that is, the Constitution is a document restraining government. It's not dictating how individuals should live. It is restraining government and putting the power in the people's hands. So the restraint on government, just like our rights stay similar, our rights stay constant regardless of events. Restraint on government stays constant regardless of events, as expressed in the Constitution. If X is restrained, then by the definition of law, it's not circumstantial. It is categorically restrained. The government cannot, under any circumstance, stop you from speaking freely, from worshiping who you want, from assembling peacefully. These things do not get stopped just because something scary is going on.
And there's the reason for that. Like, why did the framers of the Constitution and the country do that? Why is it that they built a tight chain around government power? It's because they knew that if there's even a crack in the dam, then it's going to burst.
Exactly.
And that they knew that if we do not have the appropriate checks and balances in every little aspect of federal and state government and government in general, then it is just a matter of time before government power is abused and expanded. And we know by studying history, one pretty much universal truth: whenever a central government accumulates power, it cannot be taken back without physical violence and revolution. That's just the way it works. It only goes in one direction.
The currency is blood when you buy that stuff. I mean, that's the sad truth. And especially in times like this. So the point you said about there's a crack in the dam, and there is a tight, very tight knit system here on what the government's restrained and what's expressly defined as rights for the people. For times like these, people say, oh, well, this is a new virus. Oh, this is new. It's a crisis. Do you not think the founders knew a thing or two about crisis? I mean, these documents were both, they were, the Constitution at least was after the Articles of Confederation, but decades of thought that encapsulated the revolution, the most stark break from status quo civil society in the world, the world's ever known, right? The world's never been the same since then in terms of forms of government. And a smallpox epidemic was going on. So they've got their bases covered on.
I forgot that. Smallpox epidemic.
Yeah, like to think that they didn't understand that some crazy disease that kills people was going on is to be blind to reality. So let's just say for a second, that these eternal truths weren't so eternal. Well, even circumstantially speaking, they were developing these documents during time of crises. So
Yeah. So why don't we flip this on its head? A lot of opponents to what we've been saying here, or not, I don't want to say opponents, people that are viewing things a little bit differently, possibly in the political left, maybe not. Their biggest concerns are that one, we're going to overwhelm the hospital system. Like if we hadn't shut everything down, we would overwhelm the hospital systems, and we would have hundreds of thousands of deaths. And it was our responsibility as a country to protect our vulnerable people, and that was the justification of all the measures that we put in place.
right.
So what do you have to say about that?
So I think at the beginning, theory, models, projections, and a handful of individuals that had exposure to people who made decisions kind of drove a reaction. And I can understand that to some extent, right? Some of these guidances. And we don't want to just say, oh, liberty is the end in of itself, screw everything else. That's not what our system is built on. We do loan a small portion of liberty out to the government only when it furthers the securing of our rights.
And in February, we didn't know how bad this was going to be yet.
Yeah.
Remember that.
Yeah. So, but I think the data that continues to come out substantiates the stance that all of these decisions, even if they weren't unconstitutional, were just wrong. I mean, if you're going to make decisions based on theory, you've got to commit yourself to be agile and to adapt quickly as real data comes in. And unfortunately, in this environment we're in, when someone takes a stance, now it's become political and they won't give in. They can't admit, yeah, that first decision was wrong. This is the more optimum decision. So we're just going to stick by all of these original thoughts that are wrong. The models are wrong. Every model was grossly overstated. You had organizations fear-mongering and putting out models that say there's going to be, in Texas, there is going to be 600,000 hospitalizations. And then if you go look, if you're a nerd like me and you go look at their statement on limitations of the study, you see that they literally quote, let me see if I can find it here. The data's outdated. Here it is. Okay, so in this one model by COVID Act Now, this was back in the end of March. They put out this model saying Texas is going to have over 600,000 hospitalizations if there's limited action. I would say what Texas did somewhere in between limited action and social distancing, right? So if you cut in the middle, 400,000 hospitalizations. Then you go read their known limitations. Many of the inputs into this model are based on early estimates and I quote, are likely to be wrong. Demographics, populations, and hospital bed counts are, and I quote, outdated. The model does not adjust for population density, culturally determined interaction frequency and closeness, et cetera, et cetera. So this is the crap we're making decisions off of.
Yeah, and in hindsight, all the more densely populated states had much worse levels of the outbreak. Wow, I would have never guessed that would happen. But I think you were nailing something earlier. It's like, it's called the novel coronavirus, right? We haven't had one before, so obviously we have to start with models. There is no data, right? I get that, but it is a shocking failure of government when they did not adapt to data on the ground that was constantly changing and quickly showing that the model's trajectory were nowhere close to accurate and that they needed to pivot. And government failed to pivot. They did the opposite. They dug in. And I don't know why. And then it even leads to a bigger problem that I think you were hinting at earlier. Now we've got, and again, just for context here, I am not a doctor. You are not a doctor, right? I'm in consulting now with a background in capital markets, no medical experience, besides a little bit in the Marines, but nothing to speak of. But I was reading and listening to a lot of medical opinions that were in direct contrast to what was being pushed by more centralized authorities. And those people are being censored online. And that is really scary. Like, at what point did we stop having debate, right?
Yeah.
Between in the medical community? Do you think, like, in the medical community, it's either one way or the other and that everybody agrees on everything? Like, of course not. What
People
happened
have
to that?
gone to the doctor, said, hey, you need to have a procedure. Okay, let me go get a second opinion.
Yeah,
And
where
then
did that phrase
both,
come from?
and both doctors have 180-degree different decisions on how to address the problem. This is not uncommon to have, they're both experts. They both went to
Yeah.
school. They both got their MDs. They both did their fellowships. They both did their intern, So this idea that we have to, well, first, let me touch on the first point. There's a plethora of doctors and other experts that arguably have a hell of a lot more practical experience than Fauci and Birx, who are more on the academic side, that are literally
Interesting point.
seeing patients every single day that say this is wrong. This goes, including my own physician. I talked to her about this in my virtual doctor's appointment. That anyone who studied biology to a relatively high degree has to know that we're approaching this the wrong way. It just doesn't jive with basic immunology. That if you stay inside, your immune system's going to be suppressed. You need bacteria and virus to build your immune system. So yeah, I mean, folks are getting censored. There was 600 doctors sent a note to Trump pleading to open up because they believe they're going to have worse second and third order effects from a health perspective because of quarantine. And not to mention all of the doctor's appointments that you're not going to. The one report I read, conservative estimate, 250,000 people are going to go undiagnosed of cancer this year.
Wow.
What's the likelihood you survive as compared to the coronavirus? There's over 99.8% chance you're going to survive the coronavirus. What if you are 6 months late on diagnosing cancer? This is what happens when you just stay in first level thinking, like Thomas Sowell says, and you don't think about consequences. That should be these extreme authoritarians' motto. Don't care about consequences, just act,
Yeah, I've got a friend of mine that's a surgeon, and she was saying, like, she was shocked that some cancer tests were considered non-essential and banned. Like, what on earth? Like, who made that decision? And again, that's an interesting point about Fauci and Birx being up top and I guess up in the clouds, if you will. That's literally what General Mattis is talking about. He's like, general officers sitting up top don't see what's happening on the ground, which is why you're supposed to delegate down to the lowest capable level, the doctors that are actually seeing people and saying, hey guys, this is a little strange. Why are we doing X, Y, and Z when it's our professional opinion that this is the exact opposite of what we need to be doing? And then worst of all, we've got these opinions being censored on the internet, and it's getting to a place where I'm not really comfortable with it. But
yeah, I mean, so that there's a couple things, right? We addressed civil liberties implications, and I think those things are constant. And I think moving forward, people are not going to just freely give these things up so easily because they see what's happening. I saw a survey that came out that said, I think it was a 10-point decrease in the American, registered voters that believe the government should be in charge of the economy.
wow.
Because of the coronavirus. They see what the government's doing when they take power, and they're like, well, so the 10-point swing. And
what about the Barstool Sports guy? What was he saying?
Okay. So he had a couple of rants. The first one
is the CEO, right? I can't remember his name.
CEO Dave Portnoy. And I love his rants because they're just authentic and real. And they're like, look, if first you told us no mask, then you told us mask, then like, what are you doing? Hey, Fauci, you look like a nice enough guy. but you're all over the place. There's been flip-flopping on masks. There's been flip-flopping even recently on if we're going to have another flare-up in flu season. Imagine that, a flu-like coronavirus flare-up in flu season. So now he's saying,
who would have guessed?
and then I think the first one that set him off was within a 10-day period, Fauci testifies in front of Senate and says, if we open up too quickly, mass carnage. And then 10 days later, he comes out and says, if we don't open quick enough, there's going to be, quote, irreparable damage. And everyone's like, yeah, there's irreparable damage all over the place already, bro. But like, you're all over the damn place.
And I think that was a really good example. That is a regular American who is generally apolitical, right? The most content that guy's been putting out has been critiquing pizzas, like frozen pizzas. So not exactly a constitutional scholar, but I think he's a great example of regular Americans being like, hey guys, what's going on?
Yeah.
Something isn't right. Again, there's no reason off the bat for me to not trust Dr. Fauci and Dr. Birx or anybody else that is way more qualified than any of us are, but something stinks here.
Yeah, and I mean, I think a prime example is the two doctors in Kern County in California that do most of the testing in the Bakersfield area. Dan Erickson, and I forget the other, something Mahihi, what's his name? Artin Musihi, I think. So they did a little Q&A, right, with the local media, and they basically say, hey, this is not the optimum way to go anything. They own a chain of urgent cares. They see patients every day, and they politely said, no disrespect to Fauci, but he hasn't seen a patient in over 2 decades. We're on the front lines. We see him every day. And this goes against everything we learn in basic immunology. Like, you don't take yourself out of the environment. They put out this video explaining their stances, and they go over the data, right? That in California at the time that this video came out, you were more likely to die from the regular flu than coronavirus. You are more likely to die from the regular flu, or I'm sorry, from a host of things than coronavirus at that specific time. I'd have to go and look at the data. I'd imagine it's gotten even more favorable from a survivability
standpoint. And we didn't destroy our country because of it.
Yeah. And they were censored. That video kept on getting pulled down.
What?
Kept on getting pulled down like 5 or 6 times. It keeps on getting, it's, YouTube CEO says that their community guidelines, they pull down anything that could be harmful or whatever. And when asked what that was, they say, oh, well, anything that goes against WHO.
Oh my God.
WHO, really?
Yeah.
We could do an entire episode on that. Just absolute debacle. And that's a crap show over there. So, first it's not transmitted from animals, then it was the world doesn't need to worry. I mean, they don't know. The WHO, I don't think the average American knows how troubled the track record is. That's for another time. But anyways, point is, these doctors continue to be censored. And then there's more and more people coming out saying they don't agree. Even with, I think one of the most sickening things of it is with the treatment with hydrochloroquine, Z-Pak and zinc. There's thousands, you can call it anecdotal. Call me crazy. I don't think a person cares if their life is saved anecdotally or in a double-blind placebo-controlled study. But thousands of people seeing positive results of this stuff, and doctors literally writing op-eds, and they're ignored, saying, hey, these things do show that they work, so make a decision. Then Trump says he's going to take it, and the media loses their minds. You'd think with how much they hate him, they'd be glad that he was taking it and it was going to kill him. But they just lose their minds on something that all the experts, thousands of doctors, are going to be held liable by writing a prescription for this drug that's been used for 50 years, and it's known to be very, very safe, and you can take it as a what's the term, prophylactic. And then the media is just fear-mongering that drug. You have people coming out saying that they thought it saved their life. They make a turnaround in 2 days. It's just,
like, why would media do that? Like, what's the point?
Because they honestly, it's sick and demented. And they care more about what's gonna drum up fear so that people tune in more than they do, honestly, about
Yeah, I
furthering
mean, I guess we've
our
always known that, right?
society.
Yeah, but
Um,
I think to kind of bring us full circle here, we are absolutely in no way saying that coronavirus is not serious. It's not real. Obviously, it is, right? It's late May right now. We just surpassed 100,000 deaths in the United States. It's a big deal. We're not saying it's not,
Although, let
but
me interject. I
go
will
ahead. Go
say,
ahead.
this 100,000, I don't think it's 100,000.
That's true. That's actually up for debate.
Dr. Burke said herself about a month ago, she thought that the death toll was inflated by about 25% and that they're using a quote, very liberal application of COVID deaths. And there's a financial incentive. People can say, oh, that's not going to happen. Look,
Oh, it
if
happens.
there's a financial incentive that you get more money, if you write down on a piece of paper someone died of X, call me crazy, but I put my mortgage up against that. That's being abused. I actually know a person. Personally, I know someone whose family member died in their 90s and they classified it as COVID. They did not die of COVID, and now they're going through the litigation process to try and get that fixed. So,
But by
all
the
that to
way,
say is, do what?
sorry, I saw just recently there. I'm noticing that media across the board is quoting it now. 100, I believe that 100,000 number. It said 100,000 people have died with coronavirus.
Oh,
Interesting use of language. You
yeah,
don't die with something. You die of something.
yeah.
So yeah, surprise, surprise. I think
We
some of
die
these
with
numbers are
we
being
die
brought up.
with a lot of things, right? I mean,
Yeah, exactly.
statistically, more people die with prostate cancer than of prostate cancer.
I didn't know that. Yeah.
So yeah, man. But sorry, I derailed you there. So of
No,
the
you're right. Yeah.
100,000, the point is it's a problem. We realize
Yeah.
it.
We
It's
were not
not
trying to
completely
downplay it.
fake, but there's elements that are not factual, whether it be
Yeah.
through censoring or through just straight up lying, uh,
Right.
that are coming from these governors or political officials or whatnot. So
And then you have the political left. I see these tweets that are like, oh, everybody on the political right thinks this is just a hoax. Like that, first of all, that's just dangerous and outright fraudulent. Like,
right.
get out of here. That's not what we're saying. We're saying that aspects of this are being blown up. And we're also just, the whole point of this kind of episode is like, just to remind people that civil liberties are typically not stripped in your face in front of you. They're stripped in your sleep when you're
Yeah,
not looking. And then you wake up one day, you walk in the front yard, and they're gone.
yeah,
That's why we're having this conversation.
yeah. And then it's the cherry on top that the data that continues to come out substantiates not that say this was really really bad and it was like bubonic plague bad. That still doesn't justify stripping us of what God endowed us with. Nothing does.
Yeah.
But isn't it interesting though that the data continues to substantiate a stance that, hey, dude, what do we do? We're shutting down the economy for something with over a 99% survival rate. Find me one business owner that's okay with sacrificing. There was a guy, I think it was in New Jersey. Sentiment was great. He's like, you're telling me that I have to give up my business. I've sacrificed 25 years, given my life to this thing. It provides for my family. It's a part of me. Not just physically is it my own property that I own, but it is a part of me. And you're telling me I'm going to have to give this up because of the coronavirus? I have over a 99% chance. Give me the coronavirus. Give me the coronavirus.
Dogs can't get coronavirus. You're good. All right. So wait, can they? I can't remember if dogs can get it.
Well, they can get coronaviruses, but not. I don't know.
They can't. I don't think they can transmit it though.
Yeah, I mean, literally, I just took the dog in to get a coronavirus vaccine, like, a week ago or so. But before we wrap this up, I just want to go back real quick to bad decisions and like just the power of media skewing things. Right, the tale of New York and Florida.
Of what? Sorry.
Of New York and Florida. Which,
Okay. Wow. Yeah. Those stats are crazy.
Read a report from Forbes 43% of the total deaths of coronavirus come from 0.6% of the population, people in nursing homes, right? Maybe we can provide this link in the notes. But yeah, 0.62% of the U.S. population are folks in nursing homes, and that's where over 40% of the deaths are coming. And Cuomo, along with some other folks, forced nursing homes to take back COVID positive or potentially COVID positive patients, and it wreaks havoc. Just like any, a bad flu season, if you go in and infect all the people in nursing homes, they don't have a very great chance,
I believe his defense though was that the Trump administration told him to do that.
Yeah,
I don't know if that's true or not.
I don't even know if the federal administration has jurisdiction to do that.
And you know what? Even if the Trump administration did, think about how hilarious that is. You've got a blue governor that's saying, "Oh, I did what Trump did, and it was bad. What told me to, and it was bad." Like, since when have any blue governors ever acknowledged what the Trump administration is telling him to do at all in his entire term?
Right. So
get out of here.
I think that's an important stat, right? When that points to our failure to adapt. When call it half of the deaths are coming from just people in nursing homes. This is what I was saying from the beginning. Why are we not, people are self-isolating and quarantining that are at risk? Don't let people in nursing homes if you want. But healthy folks like you and me need to be out in the environment. We need to be spreading the less virulent version of this because it creates herd immunity. You can't get herd immunity when you quarantine the herd. Instead, we created herd mentality. So I think that just points to the failure of adaptability. And then on the counter, the Florida side, they had conference calls within their medical field that said, "Hey, I know typical medical practices, we want to get people out of the hospital, you want to get them in their homes, you want to get them back to the nursing home as quickly as possible because it's just better for their overall health." That's what physicians and what healthcare professionals are used to doing. Well, not in this case. And Florida was pretty hard line about that. Yeah. What happened, right? They were supposed to be the next Italy because people were out on the beach getting sun, taking in fresh air. What happened? They actually have a great response, but Cuomo's got primetime press conferences every morning, and DeSantis is, on the streets, boots on the ground, getting stuff done. Crazy. I was thinking the whole time, how is this guy doing 3-hour pressers every day, and he's got the most populated city under? I don't know. That's for another
question. It's a good question, but no, this was a good chat. Good chat. I think we've got a lot more coming. We're going to be, first of all, give us a like, give us a follow. We're going to be putting a lot of content out, not only with these video chats, but also on your various social media platforms, Instagram, Facebook, Twitter. So stay tuned for more. I think we want to talk, not only just about current events, but I think today was a great chat because we discussed civil liberties and effectively a little bit of political philosophy through the lens of what's happening right now. And I think that's an approach that I'd really like for us to take here, is to kind of discuss the world today, but we also want to have conversations about how we got here, right? Why is it that our political discord is so crazy right now? And why everybody is so, at each other's throats, and where we come from, the major ideologies that are feeding into this country and the world today, and again, how they impact our everyday lives. So anything else you want to add to that?
Be wary of the folks that say, trust the experts. They're really just saying, comply, comply, comply. Don't sacrifice your civil liberties. So
fair enough.
Thanks for joining us, guys. Until next time.